What up, everybody? Matty Wills tapped back in with another brand new episode of Wellbeing Wednesday with Matty Wills. Of course, this is brought to you by MetroHealth, where we talk to different medical health professionals with MetroHealth, obviously, about a wide array of topics that are very pertinent to our listeners and our audience. So without further ado, before we get into today's topic, we'll bring in today's guest, the one and only Dr. David Crowe, who's been with Metro now for 15 years. And first and foremost, Dr. Crowe, thank you so much for taking some time out of your busy day to come and rap with us for a few minutes. We really appreciate it.
Of course. Thank you for the opportunity.
Absolutely. Absolutely. So before we kind of get into today's discussion, we do like for you guys to kind of just give the audience a little bit about yourself. You know, just tell us what your role is within MetroHealth and kind of what led you to be where you are today.
Sure. Absolutely. So I grew up in Cleveland, and my parents actually worked at MetroHealth years ago, and I started my career at Metro in 2011. And I've been in the dermatology department ever since. And I've been the chair of the dermatology department for 3 years, which means I oversee a lot of the educational and clinical mission of my team.
Dope. So, of course, we're talking about dermatology today as it relates to people of color. And, we'll kind of just get right into the conversation. Up first, we just want to know, why is this topic so important now, kind of more than it's ever been?
So in the United States, we're rapidly becoming a country where the majority of Americans are going to have pigmented skin or skin of color. And this is going to include people of African descent, Asian descent, Hispanics, among other ethnic groups. So in particular, Metro, I do focus on working with these individuals, but this clinic that we've set up devoted to this is not so much about me. It's about a general trend towards building a team which can highlight the importance of care for these patients in our clinics. It's really critical that these groups get the care that they need, and they've traditionally had trouble obtaining access to quality dermatologic care. The other important piece of this is that the team is adding a new doctor, a new member in July who speaks Spanish to assist with our Hispanic population, so they feel more comfortable and there's not a language barrier.
Absolutely, which is, of course, obviously important in the city that we live in. So we're talking about MetroHealth's Multicultural Dermatology Center. So, when it comes to people of color, is there a barrier in how we kind of, of us getting the proper treatment for our skincare concerns, or what exactly is the reason that there needs to be a department dedicated to it?
So I think there's two sides to this issue. I think one is that individuals in these populations have unique problems with the hair and skin, and they often face challenges getting into clinic, getting the information that they need. But the other side of the story is that physicians providing this care are not always trained to do so. There's large gaps in the training of medical students and residents on their way to becoming dermatologic physicians, and they may not get the training that they need.
So then, what exactly is the MetroHealth Multicultural Dermatology Clinic doing about that?
So right now we have 2 half days of the week where my time is devoted specifically to these patient populations, and we are specifically focusing on the education and treatment of several conditions which are more common or more severe in patients with skin of color. One of them is keloids, which are often painful or itchy scars. Skin discoloration is a big part of the focus of our clinic, either too much or too little color of specific areas of the skin. A couple of conditions that are like that include melasma, which is a disorder where there's too much pigment in the skin, and vitiligo, where there's a condition where there's not enough pigment in some areas of the skin. Another big part of dermatology that a lot of people don't know about is that hair loss, otherwise known as alopecia, is included in dermatology. We also focus a lot on hidradenitis suppurativa, which is a really severe, painful condition. And when immune system conditions like lupus involve the skin, we become involved. I would say one of the more important focuses of our clinic is that to focus on melanoma of the nail unit. Now, melanoma is a very severe type of skin cancer, and a lot of people with skin of color are not aware that when it occurs in skin of color, it's more likely to happen in the nail unit. And what that looks like is usually a really dark streak along the fingernail or the toenail, which is gradually widening. So just increasing the awareness of that is going to be huge, because often, because it's not known that this exists in a lot of amongst patients and physicians, the risk of a bad outcome is higher. In fact, the risk of death after 5 years is 3 times as high in darker skin types compared to lighter skin types in this condition.
Wow. Go ahead. No, please.
Sorry.
No, you're good.
So basically everything that we do at Metro is kind of driven by our commitment to provide patient-centered care. And this is the way we're going to reduce the health inequities in dermatology, is by focusing on it specifically in a clinic.
Got you. So I do want to circle. I want to footnote. I want to know where the center is, because I know you guys have several campuses. But just before I get to that, because I don't want to forget this, which I do forget things from time to time, so I got to just spit it out while it's top of mind. But in having these conversations, no matter kind of what specifically we're talking about, and I'm talking about our MetroHealth Wellbeing Wednesday conversations, the one thing that seems to come up a lot of time is just like awareness, like whether people of color aren't aware that they need to be looking out for certain things, or even on the professional side, to where the certain doctors or whoever we end up seeing aren't necessarily always aware of everything. So what you're saying is you guys are being super focused on that aspect of our health, and that's what the center is kind of rooted in. So what I know you guys have several campuses in Cleveland. Is it at one of those campuses, or is it a standalone?
Sure. The Monday morning clinic is at the main campus, West 25th Street office, and the Wednesday morning one is at our Cleveland Heights office. And you're exactly right that this is not just about patient care, but it's also about educating our colleagues to be able to provide good patient care in skin conditions as well, because we're certainly not the only ones seeing skin conditions in skin of color. Everybody across the system is, and it's important to be able to recognize what we're seeing.
Yeah, and to me, personally, a person in your position, making that, dare I use the term, admission that it is kind of overlooked sometimes, to me, that means a lot. It means that you are caring and that you are going the extra step to make sure that things aren't missed. So for anyone watching this right now, and I encourage you, if you are watching this, and if you know somebody, I say this every week, that needs to see this information, please feel free to pass them the link, share the video. We know everything lives on the internet forever, so it'll be here. But for someone watching this right now who sees a regular healthcare physician, on a regular basis, but it may have never had a conversation about their skin or dermatology in general, what are some questions that they should kind of pose to their general healthcare physician if they have any concerns?
So I think it should be asked how comfortable the provider is that they're seeing is, viewing the skin and diagnosing problems with it. Because often, if a provider is not comfortable with it, they will say so. And in those situations, it is best if there's a skin problem or a skin check is requested. It would be better to have a professional in dermatology actually do that procedure. Especially in conditions of the scalp and hair loss conditions, it's extremely complicated and difficult for general practitioners to unravel what's going on. So in those situations in particular, a hair loss problem, we are particularly useful in helping.
Absolutely. Again, he is Dr. David Crowe, MD, MetroHealth Department Chair of Dermatology. I'm Maddie Wills. This is Wellbeing Wednesday with Maddie Wills, brought to you by MetroHealth. I know we'll have this in the caption, but I do want to shout it out. If you need to schedule an appointment, the phone number is 216-778-3376. And then, of course, for more information, the website is metrohealth.org/MDE. Again, Dr. David Crowe, we appreciate you taking some time out of your day. We know all of you guys are busy, and these are very, very important conversations that I truly appreciate having. So again, thank you. Did we miss anything? Is there anything else that you want to throw in there before we get out of here?
No, I think we covered the important points. I really appreciate the time to talk about this and talk to everybody.
Absolutely, absolutely. And I'm sure we'll speak again at some point in the near future. So again, he's Dr. David Crowe. If you have any questions, we've got the phone number out there. We've got the website out there. This has been another episode of Wellbeing Wednesday with Maddie Wills, and we'll see you all soon. Thanks. Thanks, Doc.
Thank you.